So my talk is called How a Bill Becomes a Law, Schoolhouse Rock. And I wanted to start by telling a little bit of story. And the story is of an elderly woman named Exaltation. She's 80 years old, and she works part-time at a nursery school. After her husband died, she had to take in 6 elderly roommates, all who were actually older than 70 themselves, to pay her rent. She earns less than $13,000 a year, but she's not considered poor, according to our federal standard. Very briefly, the federal poverty guidelines are about $11,000 a year for an individual. They were developed in 1963, and they're based on data from the 1950s that at the time suggested households spend about a third of their after-tax income on food. So there's no variation depending on your age or where you live. Same here in the Bay Area as it is in Topeka, Kansas. And yet, this standard is used to access a lot of different public programs and as a way to prioritize funding to local communities. So if you're in a community that doesn't consider to have a lot of poor people, then you don't get a lot of resources. So we developed an alternative index for families and for older adults that looks at the cost of living in each community across the state of California, and it's part of a national movement to redefine the way we look at economic security in this country. And what we found is that in San Francisco, for example, older adults need closer to $27,000 a year to cover their basic costs. And we decided, well, we need to do something about this, and we need to enact some legislation that actually make policymakers pay attention to this and make some better plans for our older adults. So we did a 3-year effort developing a bill called the Elder Economic Planning Act. And it was the first in the nation to actually institutionalize an alternative way of looking at poverty in this country. And what it basically did is require local agencies to use this data as they're planning for programs for the older adults. So it was 3 years in the making. The first round got vetoed by Governor Schwarzenegger, and what he said is that we could do this administratively. We don't need a bill around this. He could do this without having this mandated. And B, that if we did this, we'd be raising expectations that we'd actually be serving more older adults. That if you actually count the number of people that are struggling, we'd have to do something, and we have no resources. So there was a fiscal pressure associated with the bill, although we had cut out the direct costs.
Go Arnold.
Go Arnold. So fast forward a couple years later, we actually did get the bill passed. And what mostly we're going to talk about is how that happened and just a little bit of sort of behind the scenes of how bills get passed. Now, the state of California is using this elder index and allocating funding and in its state plans for the older adults. We need data in order to manage our lives. And this is very much about that, because what we're saying is if you can't manage it, if you can't measure it, you can't manage it. Good policy depends on good data, and we didn't have good data to base our policies on. So ultimately, so what? We got this bill passed. What's the difference going to make in the lives of older adults in this state? So people, like the woman I was describing earlier, she's no longer considered invisible. Maybe she can get a home delivered meal in her community. Maybe she'll be able to get a ride to the doctor's office because she's now eligible for programs she wasn't eligible before. Maybe she'll be able to have a senior center in her own community. How did this happen? It was a coalition, which we all know we're all stronger together. And for us, this was really the right issue at the right time, where the aging population is growing. Senior service providers had been seeing folks like this coming to their door day in and day out, but they didn't feel they couldn't really do anything about it. They were serving them because they couldn't turn them away, but they really weren't getting any money for that and really even asked to count the people that were being served. So the aging community really coalesced around this issue, and we had foundations reporting that their grantees from across the state, decided to get involved in this, and they came to Sacramento and they testified, and we had seniors on buses, and we had AARP that came out after a couple years. They finally saw the importance, and we had 1,000 social workers descend upon the Capitol, meeting with legislators to talk about the importance of this bill, because they all thought that it meant something and that they wanted to do something to help the seniors in their community. Importantly, we built the capacity of others to lead. We participated in an institution called the Women's Policy Institute, which trains women in developing policies and in actually working on bills. And I participated in it, and I got 5 other women that were essentially a team that were staffing this to participate the first year, and then the next year, the next team decided to continue on this march And we got to the point where we could just sort of help build the capacity of others to do the work, and we could just kind of consult. And so we were sort of building that next generation of leaders. We also got some good people to sponsor the work. So as I mentioned, AARP got involved, the California Women's Foundation got involved, a lot of some of the influential groups in Sacramento. We tried to hone our message and launch media campaigns. Good policy dependent on good data. That's it. It's not a Democratic issue. It's not a Republican issue. It's not liberal. It's conservative. If you want to make decisions in the private sector, you don't use data that's 5 decades old. Why should you do that in the public sector? Why should our taxpayer dollars be any different than those in the private sector? 3 times the charm. So it was really, this bill became an organizing tool to keep the community engaged in the letters of support, the testimony. We ended up presenting to 14 different hearings throughout the legislative process. And as a result, we were educating lawmakers that had no clue, frankly, on how the poverty line was developed and talking to them about this issue. And it started to change some minds and to get people to at least, have a light bulb that went off and said, yes, we use this all the time, but we don't know anything about it. We also knew when to draw the line. Our first bill had 10 different things that we wanted to do, and we knew we weren't going to get all that passed, but we said, okay, obviously politics is the art of compromise, and policy making is watching the sausage in the making, right? So we knew when to draw the line and what we were willing to let go of, but ultimately had to have conversations with one another to say, when is this no longer worth it? And we're sort of selling ourselves by going forward. And so we sort of made some decisions about what the core of this work was about, and then knew when we'd stop. We also had to build an argument against the cost pressure, which, we took out all the direct costs to the bills. There's a fiscal analysis on all bills that go through the legislature at the state level, at the federal level, and we had to combat some of those fiscal arguments, but we took out the direct costs and, really just built an argument around this good data piece. We built relationships in key parts of the state. So the chair of the Senate Appropriations Committee, the bill got held 1 year in her committee, and we happened to have some good partners in San Diego. And so we said, okay, you've known this person for 20 years, you need to go in personally talk to her. And in one of the times that she went in to talk to her, it happened to be that the Girl Scouts were visiting. And so my friend said, oh God, great, how am I gonna convey this message? We got 20 Girl Scouts in the room. And she brilliantly said, well, Senator, can you talk to these Girl Scouts about how we measure poverty in this country? Can you tell them a little bit about it? And she went and said, yeah, just again, isn't this insane? We use this archaic data, and it's so important for people's lives. And yeah, we should really do it. Girl Scouts, shouldn't we do something about this? And so it became a kind of education tool. And importantly, we got a real legislative champion, someone that wasn't going to back down. That the 3rd year when this bill was introduced, when the staffer asked, hey, do you want to do it again? I said, I'm having another baby. I don't know that I can do this. And she said, you know what? My boss wants to take this until it gets passed. And so we're going to keep introducing the bill until it gets passed. And so I'm absolutely going to support you along the way. And so if you are ever thinking about policy work, thinking about who that author is and do they move bills, what are the relationships like? Are they actually going to fight for you and put the political capital to get it passed? And I believe that is it. Thank you.